Dr. Hill.
Madam Chair, thank you, and committee members, I thank you for allowing me to come forward and present to you today.
Could you state your name?
Oh, sorry, my name is Brian Hill, and I'm at 1102 Ivy Ridge Place, Mapleton, Georgia. Mapleton. I too am a practicing physician, and it's interesting sitting here and hearing some of the discussion with regards to this bill. I have a tendency to see things a little differently maybe than what we see from the legal perspective and maybe even our legislators, but I think our goals are ultimately the same. I have to tell you guys, I love medicine. I think medicine is a remarkable thing.
You're a urologist?
I'm a urologist, I am. It's interesting to have somebody come into your office who's sick, who has cancer, who's in pain, who's hurting, and to have them open their lives up to you, to allow you to step into their lives at the worst point in their life and try to find a way to make them whole. It really is a remarkable thing, and for that I love medicine. It's for that reason, actually, that drives me to come here and talk about this. It is that love of medicine. It's not for physicians. Medicine's not for physicians. It's for our patients, and that is our ultimate goal, is trying to find a way to make sure our patients are actually being treated the best possible way they can. A couple of things I guess I want to point out. Again, just feeling blessed being a physician, but there's a problem within our healthcare system, and there's a problem in the way that we practice medicine, and you've heard a little bit about it here. Certainly defensive medicine is one of the aspects that create problems within our healthcare system. It rises costs, it creates a level of unnecessary tests. But again, from the patient perspectives, our patients really have a couple of problems that come out of our current system. Errors are going to arise. I mean, these bodies of ours are very, very hard to work with. They're very hard to deal with. There's a lot of intricacy within these bodies, and we as humans are just error prone. It's just how we are. The problem is that we've got a disease in our system, which is our current tort system, that's actually driving some untoward consequences. And the untoward consequences are a couple things. One, outside of cost, we're disrupting the patient-physician relationship. When patients come to see me, we have a similar goal. It's to try to make them whole. It's not to create an antagonistic relationship. And unfortunately, the dirtiness that comes out of this tort really does drive a wedge between patients and physicians. And that's not something that should exist there. There should be a sacred relationship that is truly built on developing health and wellness in our patients. By creating that wedge between our patients, we really don't allow us to achieve what it is that we need to achieve. The two things that I think our tort system needs to do: find a way that if we do, or malpractice system, if we do create a level of injury in a patient, then we need to make sure that we're finding a way to actually try to compensate that patient, try to make that patient in an adjoint relationship as healthy or as well as they possibly can. And if that requires some physical compensation, then that should happen. The second thing any type of medical malpractice needs to do is to find a way to decrease patient injury. And we haven't done that with our current tort system. And that's the biggest problem that I have with our tort system, is that we've created a shame and blame approach that looks to try to find out who caused the problem rather than why the problem happened. We haven't created a way to find the systemic issues within our healthcare system. We look at the end point. And by looking at the end point, we miss the potential ways to cure this issue of rising injuries within our patients. We've got to find a way to fix that. And every physician wants that. So it's interesting. We had Dr. Harvey mentioned our House of Delegates meeting. And at that meeting, we actually had a defense attorney came and spoke to us. And he said, tort cases, they're not about facts. They're about creating a story. They're about creating villains and demons. They're about trying to find a way to make a jury buy into what it is that you're trying to sell them. And when we create this level of concealment of facts, we're never going to find a way to fix anything. And so we have to find a way to get rid of that way that tort drives the concealment of injuries and the concealment of facts to actually be able to bring them forward. And through this system, it allows that to happen. Now, I take my duty as a physician really seriously. I can't say how much more I love being a physician. When I sit down and I look at the disease in the system and see this tort problem here, I've done exactly what I do in medicine. I feel that policy is a very easy thing if you approach it as a physician. You look for evidence-based outcome data to find a way to fix the problem. And so when I've come forward and saying I'm supporting this bill, I'm supporting this bill not because I just decided to support this bill, but because I've looked at every ounce of data about this bill from 1975 Sweden's in development onward, looking at every thing that's been written about this law. I've looked at every actuarial data that's been written about this law. I've tried to find any ounce of information that I can to make sure that I can cleanly and openly sit behind this and say, I support this bill. And I do. And I do that out of information. I actually presented some of this information to the Medical Association of Georgia, and I respect the physicians there. But I will tell you, my concern is that they didn't have the information. They didn't have the data that I've had, because if they did, I truly believe, and I love Joe Wilson, I love Dr. Harvey and the group, we work together, I just don't think they had the information to make the proper decision that hopefully you will have in front of you to make the right decision. I meet physicians on a regular basis. I talk to them every day. I've got an awful big mouth, as most of my physician friends know. And when I explain this to them and talk about the true intricacies within the bill, with regards to cost, access to compensation, the way this is going to impact our malpractice premiums, the way it's going to improve our healthcare system, my physicians jump on board behind this. I have yet to find an opposition physician that's actually delved into the real meat of this to get the information that's necessary. So, as an outcome evidence-based person, I've looked at it, and this is the way to go. I believe that as much as I know how to treat a patient sitting across from my office with a kidney cancer. So I support this bill. There is a group named Docs for Patient Care as well. They're a group here in Georgia that's very active within the physician front. They support this bill. Medical Association of Georgia, a tremendous organization. I don't know if they necessarily speak for every physician group here in Georgia. And my goal will be to make sure we educate every physician, but I hope you have the information in you.
Thank you. Thank you.